welcome to day 2 of coverage of the American College of Obstetricians and Gynecologists annual clinical and scientific meeting for 2025. I'm Dr. Susan Khalil from the Department of Obstetrics, Gynecology, and Reproductive Science at the Icahn School of Medicine at Mount Sinai Hospital in New York in the United States. And today I'll highlight some of the studies from day 2 from the annual meeting. So the first study is comparing the effects of glucagon-like peptide-1 receptor agonists on cardiovascular events to metformin in patients with polycystic ovarian syndrome, a real-world multi-center cohort study across the United States. And this study looked at various sites in women who are aged over 12 years of age with polycystic ovarian syndrome. At 60 locations or 60 sites, and they had to have at least 2 prescriptions of GLP-1 and metformin. The time frame was May of 2005 through December 31st of 2021. They looked at 1-to-1 propensity score matching with a main analysis, and then looking at the study cohorts with GLP-1s where they had more than 2 versus metformin where there was more than 2 factors. Their outcomes that they looked at were cardiovascular events, thrombotic disorders, ischemic heart disease, arrhythmias, inflammatory heart disease, and major cardiovascular events. Follow-up included 1 day after index date, and they were censored upon cardiovascular event on the query date of May 17, and they also looked at those that were lost to follow-up. GLP-1 may provide superior cardiovascular protection compared to metformin in women with PCOS. That's some of the results that they found with this figure that looks at the breakdown of the cardiovascular events that were associated in these groups with metformin versus the GLP-1. Looking at this table here, this looks at the basic characteristics of the patients with PCOS before and after its use. And they go through the different cohorts with the age at index, which the average age for GLP-1s was 37.9, for metformin was 31.3, and GLP-1s were after this index time were 36 years of age and 36. So across the board, they were very similar in age. They looked at other factors like socioeconomic status, BMI, as well as their laboratory findings for serum LDL, HDL, and triglycerides, as well as their A1C. These are all noted here in this table. Their conclusions were that GLP-1 inhibitors may provide superior cardiovascular protection compared to metformin in women with PCOS, particularly in reducing arrhythmias and thrombotic disorders. And as GLP-1 use in the PCOS population expands, there's an urgent need for rigorous clinical trials and large-scale world studies to define its full risk benefit profile. Next study that I'd like to highlight from day 2 is the management of postpartum hemorrhage with intrauterine vacuum-induced hemorrhage control device versus intrauterine balloon tamponade. The methods for this study was that it was a single-site retrospective chart review study. Patients who underwent postpartum hemorrhage management using the device versus the balloon device were in 3 primary delivery sites within a large regional hospital system. They looked at this between February of 2021 and December of 2023. They looked at demographics, medical history, intrapartum management, and complications that were collected. The data was presented as median with intraquartile range and compared using the t-test or Wilcoxon rank summary tests. And then the P of less than 0.05 was considered statistically significant for this study. Of the patients that were recruited, a total of 293 postpartum hemorrhage were evaluated for this trial, and the mean age was 31.14. 72% of participants were white, 70% had private insurance. There was no significant difference in the demographics, and regardless of the delivery route, their findings were that the results were significantly lower loss with the quantitative blood loss method that they looked at. And then there was also no significant difference in uterotonic administration that was detected. And this table here just looks at the intrauterine balloon versus the vacuum, the intrauterine vacuum device, and looking at the quantitative blood loss respectively for each use. The patient clinical characteristics include use of a uterotonic was noted here with the vacuum device versus the balloon device. And the first column demonstrates the vacuum device use, with the second column looking at the intrauterine balloon device use. And then they looked at additional use of medications such as carbaprost, Methergin, Cytotec, Pitocin, tranexamic acid, as well as blood products if they had to be used for each one of these groups. The units that were used, where you can note that for the balloon device, 2 units were used, and use of platelets, which were not used at all for either group, or fresh frozen plasma, as well as cryoprecipitate or IV iron infusion as well. There was of note, though, suction, dilatation, curettage had to be implemented for 33 with the vacuum group and 14 for the intrauterine balloon group. And we also note here just that there were some exploratory laparotomies that were performed for this